This video is to demonstrate accepted routine husbandry practices in camelids. If you cannot perform these procedures safely or humanely on your own animals, or you are concerned about performing these procedures correctly and without injury to your animals or yourself, we recommend that you consult a veterinarian for assistance. In the United States, it is unlawful to offer professional veterinary services without a license. Generally, the state's Veterinary Medical Licensing Board enforces the state's code regarding the practice of veterinary medicine. Questions about this should be directed to your own state's licensing board or your veterinarian.
So today we're going to discuss giving injections to llamas and alpacas. What you see in front of you here are three 3-milliliter syringes with two different needles, an 18-gauge needle in the green cap and a 20-gauge needle in the pink cap. The main difference with why you would want to use one needle over another is basically due to the viscosity of the injection. With very viscous injections, a larger 18-gauge needle would be advantageous. With less viscous injections, a smaller 20-gauge needle would be advantageous to reduce trauma to the animal. So what we're going to do is we're going to open the syringe up. We're going to apply the needle. I'm just going to use a 20 gauge for a demonstration purpose. Most needles lock onto the syringe by pressing firmly down onto the syringe and twisting in a clockwise manner. When you pull the cap off, that exposes the needle. I'm going to draw up a little bit of the vitamin solution. You can see the approximate size of the needle there. I'm just going to draw up a small amount of the vitamin solution. You can see that using this small 20 gauge needle, it actually fills relatively slowly. Whatever amount that I'm trying to draw up, I always drop a little bit extra and then inject the remainder back into the bottle. And now I'm going to demonstrate the same thing using an 18-gauge needle instead of the 20-gauge needle that we used previously. The needle goes onto the syringe in the exact same manner. Press firmly, twist clockwise. And now, as we pull this plunger back, you can see the rapidity with which the syringe fills using an 18-gauge needle versus the 20-gauge needle. I still draw a little extra into the syringe and inject the remainder back into the bottle. Another point that I'd like to make is that if the injection fills the syringe with whatever needle size that you're using relatively quickly, this is also a pretty good indication that it will go into the animal relatively quickly, which will ultimately reduce the stress on these animals. Okay, so today we're going to demonstrate how to do subcutaneous and intramuscular injections on llamas and alpacas. Here we have a llama to demonstrate. This is Temptress. The first thing that you want to always make sure that you have in place before you ever attempt to give an injection to a llama and alpaca is proper restraint. Ideally, we would have a chute or headgate type system in place for proper restraint of the animal. For many operations and many producers, this is not a feasible alternative since they do not have these facilities in place, and we have to rely on a restraint by an assistant. This is what we're going to demonstrate today. So we have Bard here showing the proper way to restrain the head and neck of a llama. And basically what she is doing with her right hand, she has a hold of the lead rope that's attached to the halter on this animal. And with her left arm, she has placed it over the shoulders of the animal and loosely around the neck. In many instances, less restraint is more, since these animals resist to firm restraint. However, this is done on, or may vary from case to case on an individual animal basis. Once your assistant has a hold of the animal in a way that it cannot move, I like to stand before I give the injection very close to the animal. And I'm going to show you a technique that I find works very well for me for giving injections to both llamas and alpacas. I typically like to stand on the opposite side of the animal from where I'm going to actually give the injection. I'm right-handed, and therefore I like to give the injection with my right hand, and I usually stand on the left-hand side of the animal. I like to reach over the dorsum, or the back of the animal, and actually give the injection on the opposite side from which I'm standing. The reason that I do this is the animal is going to naturally try to move away from the injection, or move away from the needle when you poke it. If I give the injection on the same side that I'm standing on, the animal is going to tend to move away from me. And then I'm forced to actually chase this animal with the needle as I'm trying to give the injection. If I stand on the opposite side of the animal, then the animal is going to tend to move into my body, and I provide another level of restraint. As I just said, I like to stand very close to the animal with my hip actually making contact with the animal, providing some resistance, so if this animal does move into me, she will not move very far when I'm actually giving the injection. I also like to stand with a relatively wide-based stance, so if this animal does push against me, she doesn't knock me over. Just for demonstration purposes, I'm going to show you where I give these injections and why this technique with leaning over the back of the animal is appropriate for both subcutaneous and intramuscular injections. So after I get my wide-based stance with my hip into the animal, I'm going to show you how we lean over the back of the animal, and I actually give the injection on the opposite side. This technique of leaning over the animal is appropriate for both administering subcutaneous and intramuscular injections. For the intramuscular injection, I like to use the triceps muscle, which is this large muscle belly just right above the elbow. And for subcutaneous injections, I like to move caudally on the animal just over the cranial-thoracic area, where there is a conveniently placed loose flap of skin that you can access for giving subcutaneous injections. And one more advantage that Temptress just demonstrated for us with the technique where we lean over the back of the animal and inject on the opposite side is that if the animal would kick, two things. One is you're providing a bit more restraint for this animal as you put pressure along the back of the animal to help minimize this negative consequence of giving an injection. The other thing is if they kick, they tend to kick on the side that you're giving the injection, which is opposite the side that you're standing on, which minimizes the chance that the injector is going to be kicked and provides an increased level of safety while giving the injections. If you feel the point of the elbow and then just slide dorsally, that's going to be that large triceps muscle that is very good for intramuscular injections. So with the IM injections, we're actually going to insert the needle into the muscle itself. So I remove the cap from the needle. One common thing that I see people doing a lot is using their mouth to remove this cap. Although this is a convenient way to remove the cap, it is not recommended due to the possibility of inadvertent puncture of the lip or getting medicine into your mouth. So I palpate where that muscle is and I inject directly into the muscle. One thing that you want to be careful with, especially if giving injections that have an adverse effect if accidentally injected into a vessel, is you want to aspirate by drawing back on the syringe and make sure that no blood is visualized in the syringe prior to giving the injection. So we have our sheared alpaca for demonstration of subcutaneous injection. The area for subcutaneous injection is not actually the area of the triceps itself, but just caudal over the thorax. This is an area where it's usually easy to grab some loose skin. You can pull it up, tent that skin, and you can put that needle in just at an angle. And that does a pretty effective job for administering subcutaneous injections. For demonstration purposes, this time we're going to actually inject with a 20 gauge needle instead of the 18 gauge needle that we used previously. With the subcutaneous injection, you can really give it anywhere on the animal that you can find loose skin. I prefer the same general area of the animal, but instead of injecting actually in the triceps muscle, I move just caudal on the animal and end up over the cranial thoracic area. I find a little bit of loose skin over that area. I pull up on the skin just to tent that area. Because of his extensive fiber, it's actually hard to visualize this, but I just pinch up a little bit of skin right there. Again, the cap is removed. Pinch up on the skin, inject. Always aspirate before injection. Make sure no blood comes back into the syringe, and then inject. Although rare, complications from giving injections can result, the most serious of which is anaphylactic shock, where the animal has a severe reaction to the medication that's given, where the body basically goes into a shock phase. This can result in severe hypotension and ultimately death of the animal. Other allergic drug reactions are possible, as well as inflammation and scarring around the area where the injection is given. One severe sequelae to this is nerve damage if injected around a nerve. Anytime the skin is punctured, infection and subsequent abscess can result. Hematoma can also result if a blood vessel is damaged. And as we previously talked about, nerve damage is a likely sequelae to severe inflammation if in the area of a nerve. So we try to avoid injections, especially intramuscular injections, in areas where important nerves run, mainly the sciatic nerve, the radial nerve, etc. Some medications can be very harmful to humans if accidentally injected, and so personal injury is also another potential complication with giving injections, especially if giving injections on animals that are refractory to being handled. This is an animal that had a severe allergic reaction to an injection that was given, developed subsequent edema around the face and nose, and consequently suffered respiratory distress from the severe facial swelling and had to eventually be anesthetized and placed on a ventilator for assistance.
Although injections are considered routine husbandry practices, they are not without risk of injury to you or your animals. Before attempting injections on your own animals, we recommend that you work with your veterinarian to be sure you can safely perform these procedures. Again, only a licensed veterinarian may offer professional veterinary services to others in the United States.